Hi there, I'm Dr. Handler, and today we'll be talking about balloon sinuplasty. This is a webinar meant for our audience online to learn a little bit more about our in-office treatment for blocked sinuses. So really this is an office-based procedure for patients suffering from nasal obstruction and or sinusitis. But I think a better way to think about this is any of you out there that have a nose problem, this potentially could be an option for you depending on what we find during our evaluation. So that's congestion, that's pressure, that's headachy stuff, that's sinus drainage, recurrent sinus infections, just not breathing well through your nose not functioning, it's all of those things. During this procedure, sinus passageways are enlarged and normal sinus drainage and functions restored. This helps with breathing, this helps with pressure, this helps with decreasing the incidence and the frequency of which you get sinus infections. This really is a minimally invasive option for patients who do not want to go to the operating room and deal with longer downtime. The analogy I always use is that office-based procedures, and specifically like balloon sinuplasty, that's like hitting the double. The operating room might be the triple. It might be a little bit more aggressive, might be a little bit better, but both are very, very good. The advantage here is the downtime is a lot less, and you're not on pain medication. So who's really a good candidate for sinus dilation? So it's those patients out there that have chronic infections, or even repeat acute infections, meaning that you're getting a sinus infection, once a month or once every 3 months, you're on antibiotics, you get normal again for a little bit of time, then you get wham, hit with another sinus infection. It's also for people that have sinus pressure headaches. So, how do you know if your headaches are sinus related? Well, we can do an image and find out if you've got sinus issues, and a lot of people have pressure in areas that those sinuses are located. It's also for people that have nasal congestion or just obstruction or just bad breathing through their nose. So how does it work? This kind of cartoon representation shows the idea of what we do, and basically it's a small little flexible guide wire that can go up through those tight little sinus passageways. And keep in mind, these sinus passages are only about 1 to 2 millimeters in diameter natively. They're a bony canal, and within that bony canal is lining. And lining is what gets big and small. And so when you're sick, that lining gets inflamed and boom, it pinches down those sinuses and those sinus passageways, and that's why you get all that pressure and all that congestion. That's why people get sinus infections, because they can't drain. And so this balloon uses a guide wire to get up through those sinuses, as you can see here with the circle. The balloon slides over that guide wire, and the balloon is just a tool to inflate and enlarge that bony canal. So think of, we are widening the neck of the hourglass. And except it's not shattering, of course, it's just actually getting larger. And so what that means is better mucus flow out and better airflow in. The balloon then comes out. Now the reason why the sinus passageway doesn't collapse back down is because there's nothing for it to fall back into. Again, as I spoke to, there's lining inside and outside of that bony canal, and so we remodel that canal. And here's a picture showing that balloon inflated, enlarging that passageway, as I spoke to in that previous slide. And then again, normal sinus drainage is restored. And so this is with the balloon deflated, and you can see it's a much larger, wider passageway. So what to expect? So this gives kind of the basic setup of the procedure room. There's an optional sedative. So I say about 25 to 30% of patients opt to take a pre-medication. So what's that? Basically, it's kind of like a Valium. It's a class of medication that's like Valium. It just makes you care a lot less. Our perspective here at Advent is, if you think you want to take this and you know yourself better than I do, take it. It's not a problem. You just need somebody to drive you home. Otherwise, we talk you through everything as we go, and we try to make this as comfortable as possible. There is local anesthetic. So this is a spray in your nose, and then there's cotton that has anesthetic on it, and then there's actual local anesthetic in your nose. Each step builds on the next to make things very numb. There's different degrees of pressure that you'll feel in weird spots, and that's what I tell most people, is that the procedure is weird. I've had it done. It's still hard for me to describe to people what it feels like. It's just strange, and so it's the fear of the unknown that I think makes people a little bit anxious, but most people on the back end of it, once we're done, say, oh, that wasn't as bad as what I expected. Commonly, balloon sinus dilation is done with turbinate reduction, and turbinate reduction is kind of the main pipe obstructors in the nose. The sinuses are what surround that main pipe, and so if we reduce those turbinate tissues, that adds to breathing improvement, as well as better airflow up into sinuses. And again, the advantage of doing something in the office is really that there's really zero downtime. And what I mean by that is, well, it's about 0 to 2 days. I had my procedure done on a Thursday night, work the next day. Some people take a day off, just depends on the person. Here's a little clip of Dr. Candula's experience with balloon sinuplasty.
We're going towards the cheek sinus on my left-hand side. So we're just trying to get this natural sinus opening expanded.
Okay,
So
let's do about 16.
A little bit of pressure here, not bad. And a little bit more. I can feel it kind of in my upper teeth a little bit. We're going to switch gears over towards more in the breathing passageways. So trying to reduce the turbinates. So in order to do that, first thing we need to do is make sure things are nicely numb still. And I'm not feeling any of that, which is a good sign.
A little smoke, a little pressure.
So I can smell smoke, which is not really smoke, but it smells smoky. Otherwise, not a whole lot of action going on there.
So next is a little bit of summary of the balloon dilation results. And this is kind of looking at some of the studies that were out there initially when this technology kind of came to the forefront. This is kind of in the mid-2000s, early 2000s. And so one thing is, again, it's well tolerated by patients using local anesthesia. Again, I joke, but a lot of patients say, oh, hey, that wasn't as bad as the dentist. I always think of that as being a positive thing, you know. Everybody has perspective on what dental work feels like. And so if somebody says that to me, I'm like, hey, we're doing the right thing here. It has significant and meaningful improvement in nasal obstruction through a minimum of 2 years. And so, you know, ENTs thinking they're funny, of course, have funny acronyms for their studies. So, of course, this was the SNOT 22 study. But basically what this was showing is that over a 2-year period of time, the quality of life was still improved for the patient. Also, there's a low rate of revision sinus surgery. It's equal to or better or lower revision rate than your typical sinus surgery in the operating room. And most importantly, it's got a high patient satisfaction, and it gets people back to their normal activities quickly. And I think that one overarching theme of balloon sinuplasty and what we do in the office in general with these procedures is that it's a minimal downtime. You know, it's a minimal impact early on as far as negatively impacting your life with downtime to get a huge impact long-term positively, right? So it's a huge quality of life win for patients. It doesn't mean going to the operating room. It doesn't mean having to be on pain medication. It does mean, hey, a day or two of just feeling like you got a little bit of a cold or sinus infection, maybe a little bit of soreness, but it can make a big impact on people's lives to get their noses working and breathing better. And then, of course, there's always a question about insurance. And I would say, you know, Advent does not require referral. So you can come see us if you want to come see us. You don't need a gatekeeper. You don't need your primary care to refer you here. If you want to come see us and hear what we have to say and get an exam, I highly encourage it, but you can make that choice for yourself. And then as far as insurance, fortunately, most insurances cover balloon sinuplasty. What the cost is to a patient depends on your plan and your deductible and all that kind of stuff. But fortunately, the majority of insurances out there do cover this as an in-office procedure. And so I highly encourage you to visit our website insurance page for a list of in-network providers. It's listed here. I look forward to seeing you again in the future. Thank you.